हेलो एवरीवन। आज के हमारे एमसीक्यूज़ के टॉपिक का नाम है क्रेनियल नर्व्स। क्वेश्चन नंबर 1, हाउ मैनी पेयर्स ऑफ क्रेनियल नर्व्स अराइजेज फ्रॉम द ब्रेन? ऑप्शन ए 10, ऑप्शन बी 12, ऑप्शन सी 14, ऑप्शन डी 15. Correct answer is option B, 12 pairs. Question number 2, olfactory nerve is responsible for option A vision, option B smell, option C hearing, option D taste. Correct answer is option B, smell. Question number 3, which cranial nerve exits through the cribriform plate? Option A optic, option B olfactory, option C oculomotor, option D trochlear. Correct answer is option B, olfactory. Question number 4, to assess the olfactory nerve, the nurse should option A ask the patient to identify familiar smells with eyes closed, option B check people's reaction to light, option C test visual acuity with the Snellen chart, option D ask the patient to smile and frown. Correct answer is option A, ask the patient to identify familiar smells with eyes closed. Question number 5, which test assesses olfactory nerve function? Option A smelling coffee or vanilla, option B reading a Snellen chart, option C whisper test, option D corneal reflex. Correct answer is option A, smelling coffee or vanilla. Question number 6, a patient complains of loss of smell after a head injury. Which cranial nerve is most likely affected? Option A cranial nerve 2 optic, option B cranial nerve 1 olfactory nerve, option C cranial nerve 5 trigeminal nerve, option D cranial nerve 7 facial nerve. Correct answer is option B, cranial nerve 1 olfactory nerve. Question number 7, loss of smell anosmia may occur due to injury of option A temporal lobe, option B frontal lobe or cranial nerve 1, option C occipital lobe, option D bones. Correct answer is option B, frontal lobe or cranial nerve 1. Question number 8, which cranial nerve is purely sensory for vision? Option A olfactory, option B optic, option C oculomotor, option D trochlear. Correct answer is option B, optic cranial nerve 2. Question number 9, optic nerve cranial nerve 2 transmits impulses related to option A smell, option B hearing, option C vision, option D taste. Correct answer is option C, vision. Question number 10, swinging flashlight test is used for option A cranial nerve 1, option B cranial nerve 2, option C cranial nerve 3, option D cranial nerve 5. Correct answer is option B, cranial nerve 2, optic. Question number 11, the optic nerve cranial nerve 2 is commonly assessed by option A whisper test, option B Snellen chart and visual field test, option C checking tongue movement, option D gag reflex test. Correct answer is option B, Snellen chart and visual field test. Question number 12, a lesion of the optic chiasm typically causes option A complete blindness in one eye, option B bitemporal hemianopia, option C diplopia, option D ptosis. Correct answer is option B, bitemporal hemianopia. Question number 13, the oculomotor nerve cranial nerve 3 controls option A eye movement and pupil constriction, option B facial expression, option C swallowing, option D hearing. Correct answer is option A, eye movement and pupil constriction. Question number 14, accommodation reflex involves which cranial nerve? Option A cranial nerve 2 and 3, option B cranial nerve 5 and 7, option C cranial nerve 9 and 10, option D cranial nerve 11 and 12. Correct answer is option A, cranial nerve 2 and 3, optic and oculomotor. Question number 15, damage to cranial nerve 3 causes option A ptosis, diplopia and pupil dilation, option B hearing loss, option C facial paralysis, option D loss of taste. Correct answer is option A, ptosis, diplopia and pupil dilation. Question number 16, the oculomotor nerve supplies all eye muscles except option A lateral rectus and superior oblique, option B medial rectus and inferior oblique, option C superior and inferior rectus, option D levator palpebrae only. Correct answer is option A, lateral rectus and superior oblique. Question number 17, which reflex involves cranial nerve 2 and 3? Option A pupillary light reflex, option B corneal reflex, option C gag reflex, option D cuff reflex. Correct answer is option A, pupillary light reflex. Question number 18, when the nurse shines a light into one eye and observes pupil constriction in both eyes, she is assessing option A cranial nerve 2 and 3, option B cranial nerve 4 and 6, Option C, cranial 7 and 9. Option D, cranial 5 and 10. Correct answer is option A, cranial 2 and 3, optic and oculomotor. Question number 19. What does the light reflex test indicate? Option A, retinal and optic nerve health only. Option B, coordination of cranial 2 and 3. Option C, brainstem auditory function. Option D, facial nerve response. Correct answer is option B, coordination of cranial 2 and 3. Question number 20. Damage to the oculomotor nerve results in option A, eye deviating downward and outward with ptosis. Option B, inability to close the eyelids. Option C, loss of corneal reflex. Option D, double vision only. Correct answer is option A, eye deviating downward and outward with ptosis. Question number 21. Which cranial nerve is purely motor? Option A, trochlear nerve. Option B, olfactory nerve. Option C, vestibulocochlear nerve. Option D, glossopharyngeal nerve. Correct answer is option A, trochlear nerve, cranial nerve 4. Question number 23. The trochlear nerve innervates which muscles? Option A, superior oblique. Option B, lateral rectus. Option C, medial rectus. Option D, inferior oblique. Correct answer is option A, superior oblique. Question number 24. Which cranial nerve is called the eye rolling nerve? Option A, oculomotor. Option B, trochlear. Option C, abducens. Option D, facial. Correct answer is option B, trochlear, cranial nerve 4. Question number 25. A lesion in the cranial nerve 4 results in option A, difficulty moving the eye downward and inward. Option B, loss of smell. Option C, facial droop. Option D, hearing loss. Correct answer is option A, difficulty moving the eye downward and inward. Question number 26. The only cranial nerve that crosses to the opposite side before exiting is option A, cranial nerve 3. Option B, cranial nerve 4. Option C, cranial nerve 6. Option D, cranial nerve 9. Correct answer is option B, cranial nerve 4, trochlear. Question number 27. The cranial nerve 5 trigeminal nerve is option A, purely sensory. Option B, purely motor. Option C, mixed sensory and motor. Option D, autonomic. Correct answer is option C, mixed sensory and motor. Question number 28. Which branch of the trigeminal nerve supplies the lower jaw? Option A, ophthalmic. Option B, maxillary. Option C, mandibular. Option D, facial. Correct answer is option C, mandibular. Question number 29. The motor part of the cranial 5 controls option A, muscle of mastication. Option B, muscle of facial expression. Option C, tongue muscles. Option D, eye muscles. Correct answer is option A, muscles of mastication. Question number 30. Jaw jerk reflex tests. Option A, cranial nerve 5. Option B, cranial nerve 7. Option C, cranial nerve 9. Option D, cranial nerve 10. Correct answer is option A, cranial nerve 5, trigeminal nerve. Question number 31. A positive jaw jerk reflex suggests option A, upper motor neuron lesion above bones. Option B, lower motor neuron lesion. Option C, Bell's palsy. Option D, glossopharyngeal palsy. Correct answer is option A, upper motor neuron lesion. Question number 32. Trigeminal neuralgia affect which nerve? Option A, cranial nerve 4. Option B, cranial nerve 5. Option C, cranial nerve 6. Option D, cranial nerve 7. Correct answer is option B, cranial nerve 5, trigeminal nerve. Question number 33. Which nerve is assessed when testing the patient's ability to clench teeth? Option A, cranial nerve 5, trigeminal motor branch. Option B, cranial nerve 7. Option C, cranial nerve 9. Option D, cranial nerve 10. Correct answer is option A, cranial nerve 5, trigeminal motor branch. Question number 34. Loss of sensation over face and weak chewing, lesion of option A, cranial nerve 5. Option B, cranial nerve 7. Option C, cranial nerve 9. Option D, cranial nerve 10. Correct answer is option A, cranial nerve 5, trigeminal nerve. Question number 36. Corneal reflex involve option A, afferent cranial nerve 5 and efferent cranial nerve 7. Option B, afferent cranial nerve 9 and efferent cranial nerve 10. Option C, afferent cranial nerve 2 and efferent cranial nerve 3. Option D, afferent cranial nerve 8 and efferent cranial nerve 9. Correct answer is option A, afferent cranial nerve 5 and efferent cranial nerve 7. Question number 37. The foramen ovale transmits which cranial nerve branch? Option A, mandibular division of trigeminal. Option B, maxillary division of trigeminal. Option C, ophthalmic division of trigeminal. Option D, trochlear. Correct answer is option A, mandibular division of trigeminal. Question number 38. To check the trigeminal nerve, cranial 5, the nurse should option A, observe facial symmetry while the patient smiles. Option B, test light touch and pinprick sensation on the face. Option C, ask the patient to shrug shoulders. Option D, assess taste on posterior tongue. Correct answer is option B, test light touch and pinprick sensation on the face. Question number 39. Testing eye abduction checks. Option A, cranial 3. Option B, cranial 4. Option C, cranial 6. Option D, cranial 7. Correct answer is option C, cranial 6. Question number 40. The abducens nerve cranial 6 controls which eye muscle? Option A, superior rectus. Option B, lateral rectus. Option C, medial rectus. Option D, inferior oblique. Correct answer is option B, lateral rectus. Question number 41. During an eye exam, the nurse notices that the patient's right eye doesn't move laterally. Which cranial nerve may be damaged? Option A, cranial 3 oculomotor. Option B, cranial 4 trochlear. Option C, cranial 6 abducens. Option D, cranial 7 facial. Correct answer is option C, cranial 6 abducens. Question number 42. Assessment of abducens nerve cranial 6 includes option A, testing lateral eye movement. Option B, checking hearing. Option C, assessing gag reflex. Option D, asking the patient to clench teeth. Correct answer is option A, testing lateral eye movement. Question number 43. The sensory part of cornea is supplied by option A, cranial 3. Option B, cranial 6, ophthalmic branch. Option C, cranial 7. Option D, cranial 9. Correct answer is option B, cranial 6, ophthalmic branch. Question number 44. Damage to the cranial 6 leads to option A, medial deviation of eye, inability to abduct. Option B, facial weakness. Option C, deafness. Option D, tongue deviation. Correct answer is option A, medial deviation of the eye. Question number 45. Which cranial nerve is checked when assessing extraocular movements? Option A, cranial 3, 4 and 6. Option B, cranial 2 and 5. Option C, cranial 7 and 8. Option D, cranial 9 and 10. Correct answer is option A, cranial 3, 4 and 6, used in age pattern eye movement test. Question number 46. During ocular movement testing, the nurse observes eye coordination in 6 cardinal field of gaze. This assesses which nerves? Option A, cranial 3, 4 and 6. Option B, cranial 2, 5 and 7. Option C, cranial 5, 8 and 9. Option D, cranial 7, 10 and 11. Correct answer is option A, cranial 3, 4 and 6. Question number 47. Loss of corneal reflex suggests lesion in option A, cranial 5 and 7. Option B, cranial 2 and 3. Option C, cranial 9 and 10. Option D, cranial 6. Correct answer is option A, cranial 5 and 7. Question number 48. Which cranial nerve supplies facial muscles and taste on anterior 2/3 of the tongue? Option A, cranial 5. Option B, cranial 7. Option C, cranial 9. Option D, cranial 10. Correct answer is option B, cranial 7, facial. Question number 49. Bell's palsy is due to lesion of option A, cranial 7. Option B, cranial 5. Option C, cranial 9. Option D, cranial 10. Correct answer is option A, cranial 7. Question number 50. In Bell's palsy, which side of the face is affected? Option A, same side as lesion. Option B, opposite side. Option C, both sides equally. Option D, only upper face. Correct answer is option A, same side as lesion. Question number 51. The taste buds on the soft palate are supplied by option A, cranial 9. Option B, cranial 10. Option C, cranial 7. Option D, cranial 5. Correct answer is option C, cranial 7, facial. Question number 52. Facial droop and loss of taste. Lesion of option A, cranial 7. Option B, cranial 9. Option C, cranial 5. Option D, cranial 12. Correct answer is option A, cranial 7. Question number 53. Which reflex tests the integrity of the cranial nerves 5 and 7? Option A, gag reflex. Option B, corneal reflex. Option C, jaw jerk reflex. Option D, cuff reflex. Correct answer is option B, corneal reflex. Cranial 5 senses the touch and cranial 7 closes the eyelid. Question number 54. When assessing the facial nerve, the nurse should ask the patient to option A, smile, puff cheeks, raise eyebrows. Option B, shrug shoulders and turn head. Option C, stick out tongue and move side to side. Option D, swallow and say ah. Correct answer is option A, smile, puff cheeks and raise eyebrows. 55. The blink reflex pathway includes option A, cranial nerve 5 efferent and cranial nerve 7 efferent. Option B, cranial nerve 2 and 3. Option C, cranial nerve 9 and 10. Option D, cranial nerve 8 and cranial nerve 6. Correct answer is option A, cranial nerve 5 afferent and cranial nerve 7 efferent. Question number 56. The cranial nerve controlling tear and salivary secretion is option A, cranial nerve 7 facial. Option B, cranial nerve 9 glossopharyngeal. Option C, cranial nerve 10 vagus. Option D, cranial nerve 5 trigeminal. Correct answer is option A, cranial nerve 7 facial. Question number 57. Hearing and balance are functions of which cranial nerve? Option A, cranial nerve 5. Option B, cranial nerve 8. Option C, cranial nerve 10. Option D, cranial nerve 12. Correct answer is option B, cranial nerve 8, vestibulocochlear. Question number 58. Vestibular part of the cranial nerve 8 is concerned with option A, balance. Option B, hearing. Option C, taste. Option D, smell. Correct answer is option A, balance. Question number 59. Cochlear part of the cranial nerve 8 is responsible for option A, hearing. Option B, vision. Option C, smell. Option D, swallowing. Correct answer is option A, hearing. Question number 60. If a patient has vertigo and tinnitus, which nerve is affected? Option A, cranial nerve 5. Option B, cranial nerve 7. Option C, cranial nerve 8. Option D, cranial nerve 10. Correct answer is option C, cranial nerve 8. Question number 60. The internal acoustic meatus transmits option A, cranial nerve 7 and 8. Option B, cranial nerve 5. Option C, cranial nerve 9. Option D, cranial nerve 12. Correct answer is option A, cranial nerve 7 and 8. Question number 61. The acoustic reflex involves which cranial nerve? Option A, cranial nerve 2. Option B, cranial nerve 8. Option C, cranial nerve 7. Option D, cranial nerve 9. Correct answer is option B, cranial nerve 8, vestibulocochlear. Question number 63. Hearing is tested using option A, whisper, Rene and Weber test. Option B, Snellen chart. Option C, smell test. Option D, taste test. Correct answer is option A, whisper, Rene and Weber test. Question number 64. The Rene test compares option A, air conduction and bone conduction of sound. Option B, left and right ear loudness. Option C, frequency and pitch discrimination. Option D, sound localization ability. Correct answer is option A, air conduction and bone conduction. Normally, air conduction is greater than bone conduction, and abnormal in conductive loss, bone conduction is greater than or equal to air conduction. Question number 65. In a normal Rene test result, option A, air conduction is longer and louder than bone conduction. Option B, bone conduction is longer than air conduction. Option C, both are equal. Option D, neither is heard. Correct answer is option A, air conduction is greater than bone conduction. Question number 66. A patient with conductive hearing loss will show option A, bone conduction greater than air conduction on Rene test. Option B, air conduction greater than bone conduction on Rene test. Option C, equal air conduction and bone conduction. Option D, no hearing on either side. Correct answer is option A, bone conduction is greater than air conduction. Question number 67. In Rene test, the tuning fork is placed first on the option A, mastoid process, then near the ear canal. Option B, forehead. Option C, cheekbone. Option D, behind the neck. Correct answer is option A, mastoid process, then near ear canal. Question number 68. The Weber test is used to assess option A, lateralization of sound. Option B, frequency hearing. Option C, reflex arc of cranial nerve 8. Option D, middle ear muscle contraction. Correct answer is option A, lateralization of sound. Question number 69. In the Weber test, sound lateralizes to the affected ear in option A, conductive hearing loss. Option B, sensory neural hearing loss. Option C, normal hearing. Option D, bilateral hearing loss. Correct answer is option A, conductive hearing loss. Question number 70. In sensory neural hearing loss, Weber test sound lateralizes to option A, the unaffected ear. Option B, the affected ear. Option C, both ears equally. Option D, none. Correct answer is option A, the unaffected ear. Question number 71. The whisper test assesses. Option A, high frequency hearing using whispered voice at 1 to 2 feet distance. Option B, bone conduction. Option C, low frequency vibration. Option D, reflex arc. Correct answer is option A, high frequency hearing using whispered voice. Question number 72. In the whisper test, the nurse should: option A, stand behind the patient and whisper random numbers or words. Option B, use a tuning fork on the forehead. Option C, ask the patient to close both ears. Option D, use loud voice near the ear. Correct answer is option A, stand behind the patient and whisper random words or numbers. Question number 73. Which of the following indicates sensory neural hearing loss? Option A, Weber test lateralizes to normal ear. In Rene test, air conduction is greater than bone conduction, but it would be reduced. Option B, Weber test lateralizes to affected ear. In Rene test, bone conduction would be greater than air conduction. Option C, Weber test equal. In Rene test, air conduction would be greater than bone conduction. Option D, whisper test normal. Correct answer is option A, Weber test lateralizes to normal ear. Rene test, air conduction would be greater than bone conduction but would be reduced. Question number 74. Conductive hearing loss is due to pathology in: option A, external or middle ear, for example due to wax, otitis media. Option B, cochlea or auditory nerve. Option C, brainstem or temporal lobe. Option D, semicircular canals. Correct answer is option A, external or middle ear. Question number 75. Sensory neural hearing loss results from: option A, damage to the inner ear or cranial nerve 8. Option B, blocked ear canal. Option C, otitis externa. Option D, tympanic membrane perforation. Correct answer is option A, damage to the inner ear or cranial nerve 8. Question number 76. A 40-year-old patient presents with equal Rene test results. Air conduction is greater than bone conduction but reduced intensity in one ear. Weber test lateralizes to the opposite ear. What would be diagnosis? Option A, sensory neural hearing loss. Option B, conductive loss. Option C, normal hearing. Option D, mixed loss. Correct answer is option A, sensory neural hearing loss. Question number 77. A nurse finds bone conduction is greater than air conduction in the right ear and sound lateralizing to the same ear on Weber test. What would be diagnosis? Option A, conductive hearing loss in right ear. Option B, sensory neural hearing loss in right ear. Option C, normal. Option D, bilateral loss. Correct answer is option A, conductive hearing loss in right ear. Question number 78. A tuning fork of which frequency is usually used in Rene and Weber test? Option A, 512 Hz. Option B, 125 Hz. Option C, 1000 Hz. Option D, 64 Hz. Correct answer is option A, 512 Hz. Question number 79. Which of the following can cause sensory neural hearing loss? Option A, aging, presbycusis. Option B, acoustic neuroma. Option C, ototoxic drugs, for example aminoglycosides. Option D, all of above. Correct answer is option D, all of above. Question number 80. In conductive hearing loss, the whisper test usually: option A, fails on affected ear. Option B, remains normal. Option C, shows louder perception through bone. Option D, is unaffected by whispering distance. Correct answer is option A, fails on affected ear. Question number 81. The nurse documents Weber lateralized to right, Rene negative on right. What would be interpretation? Option A, right-sided conductive hearing loss. Option B, right-sided sensory neural hearing loss. Option C, normal test. Option D, bilateral sensory neural hearing loss. Correct answer is option A, right-sided conductive hearing loss. Question number 82. The auditory pathway begins in: option A, cochlear hair cells, then cranial nerve 8, then brainstem, then auditory cortex. Option B, tympanic membrane, then ossicles, then nasopharynx. Option C, pinna, then middle ear, then cerebellum. Option D, semicircular canals, then cranial nerve 9, and then thalamus. Correct answer is option A, cochlear hair cells, then cranial nerve 8, then brainstem, and then auditory cortex. Question number 83. Vertigo and tinnitus is caused by damage to option A cranium 5, option B cranium 8, option C cranium 9, option D cranium 10. Correct answer is option B cranium 8, vestibulocochlear nerve. Question number 84. Which nerve controls taste on posterior 1/3 of the tongue and gag reflex? Option A cranium 9, option B cranium 7, option C cranium 10, option D cranium 11. Correct answer is option A cranium 9, glossopharyngeal. Question number 85. Loss of smell and taste both lesion would be likely in option A cranium 1 and cranium 7 or 9, option B cranium 2 and 3, option C cranium 5 and 6, option D cranium 10 and 11. Correct answer is option A cranium 1 and cranium 7 or 9. Question number 86. The gag reflex is elicited by stimulating the posterior pharyngeal wall to assess option A cranium 9 and 10, option B cranium 5 and 7, option C cranium 2 and 3, option D cranium 11 and 12. Correct answer is option A cranium 9 and 10. Question number 87. What is the assessed by the nurse when asking the patient to say ah? Option A movement of soft palate and uvula, cranium 9 and 10, option B facial symmetry, option C eye movement, option D jaw clenching. Correct answer is option A movement of soft palate and uvula, cranium 9 and 10. Question number 88. Which cranial nerve has both sensory and motor function? Option A hypoglossal nerve, option B vagus nerve, option C accessory nerve, option D olfactory nerve. Correct answer is option B vagus nerve. Question number 89. Which cranial nerve has the longest course in the body? Option A facial, option B vagus, option C trigeminal, option D hypoglossal. Correct answer is option B vagus nerve. Question number 90. Which cranial nerve extends to thoracic and abdominal organs? Option A cranium 8, option B cranium 10, option C cranium 9, option D cranium 7. Correct answer is option B cranium 10, vagus nerve. Question number 91. The vagus nerve supplies parasympathetic fibers to option A heart, lungs and gastrointestinal tract, option B eyes, option C kidneys, option D skin. Correct answer is option A heart, lungs and gastrointestinal tract. Cranial nerve. Question number 92. Which cranial nerve reflex control heart rate and digestion? Option A cranium 10 vagus, option B cranium 9, option C cranium 11, option D cranium 7. Correct answer is option A cranium 10 vagus nerve. Question number 93. The hoarseness and dysphagia occur due to damage of option A cranium 10, option B cranium 7, option C cranium 9, option D cranium 11. Correct answer is option A cranium 10 vagus nerve. Question number 94. Cuff reflex involves option A cranium 9 and 10, option B cranium 2 and 3, option C cranium 5 and 7, option D cranium 11 and 12. Correct answer is option A cranium 9 and 10. Question number 95. Which cranial nerve is checked by testing palate elevation? Option A cranium 9 and 10, option B cranium 5, option C cranium 7, option D cranium 12. Correct answer is option A cranium 9 and 10. Question number 96. Which cranial nerve is known as the wanderer? Option A hypoglossal, option B trochlear, option C vagus, option D facial. Correct answer is option C vagus nerve. Question number 97. In brainstem death testing, absence of corneal, gag and pupillary reflexes indicates option A brainstem dysfunction, option B facial paralysis, option C hypoglossal lesion, option D vestibular disorder. Correct answer is option A brainstem dysfunction. Question number 98. A patient reports difficulty swallowing and hoarseness after surgery in the neck region. The nurse should suspect damage to option A cranium 9 glossopharyngeal nerve, option B cranium 10 vagus nerve, option C cranium 11 accessory nerve, option D cranium 12 hypoglossal nerve. Correct answer is option B cranium 10 vagus nerve. Question 99. Accessory nerve cranium 11 supplies option A sternomastoid muscles and trapezius muscle, option B facial muscles, option C tongue muscles, option D eye muscles. Correct answer is option A sternomastoid muscles and trapezius muscles. Question number 100. The accessory nerve cranium 11 controls option A tongue muscles, option B shoulder and neck muscles, option C eye muscles, option D facial muscles. Correct answer is option B, shoulder and neck muscles. Question number 101. To test the accessory nerve, cranial nerve 11, the nurse asked the patient to option A, shrug shoulders and turn head against resistance. Option B, close eyes tightly. Option C, move tongue side to side. Option D, stick out tongue and say ah. Correct answer is option A, shrug shoulders and turn head against resistance. Question number 102. If a patient cannot shrug shoulders and has difficulty turning head, the nerve affected is option A, cranial nerve 9, option B, cranial nerve 10, option C, cranial nerve 11, option D, cranial nerve 12. Correct answer is option C, cranial nerve 11. Question number 103. The hypoglossal nerve, cranial nerve 12, controls option A, swallowing, option B, tongue movements, option C, hearing, option D, facial expressions. Correct answer is option B, tongue movements. Question number 104. When the tongue deviates to one side, the lesion is on option A, same side as deviation, option B, opposite side, option C, bilateral side, option D, none. Correct answer is option A, same side as deviation. Question number 105. Testing cranial nerve 12 includes asking the patient to option A, stick out tongue and move side to side, option B, say ah, option C, close eyes, option D, shrug shoulders. Correct answer is option A, stick out tongue and move side to side. Question number 106. The doll's eye reflex checks option A, brainstem and ocular motor nerves, option B, cerebellum, option C, spinal cord, option D, limb reflexes. Correct answer is option A, brainstem and ocular motor nerves. Question number 107. Cranial nerves 9 and 10 both passes through option A, jugular foramen, option B, foramen ovale, option C, optic canal, option D, foramen rotundum. Correct answer is option A, jugular foramen. Question number 108. The olfactory nerve cranial 1 and optic cranial 2 nerves differ from others because they originate from option A, brainstem, option B, cerebrum and diencephalon, option C, spinal cord, option D, cerebellum. Correct answer is option B, cerebrum and diencephalon. Question number 109. Bilateral loss of pupillary reflex lesion at option A, midbrain cranial nerve 2 and 3 pathway, option B, pons, option C, medulla, option D, cortex. Correct answer is option A, midbrain. Question number 110. The pons gives rise to which cranial nerves? A, cranial nerve 3 and 4, option B, cranial nerve 5, 6, 7 and part of 8, option C, cranial nerve 9 and 10, option D, cranial nerve 11 and 12. Correct answer is option B, cranial nerve 5, 6, 7 and part of 8. Question number 111. Which is the only cranial nerve that emerges from the dorsal side of the brainstem? Option A, optic nerve cranial nerve 2, option B, trochlear nerve cranial nerve 4, option C, facial nerve cranial nerve 7, option D, hypoglossal nerve cranial nerve 12. Correct answer is option B, trochlear nerve cranial nerve 4. Question number 112. The medulla oblongata is the origin site of which cranial nerves? Option A, cranial nerve 9, 10, 11 and 12, option B, cranial nerve 1 and 2, option C, cranial nerve 3 and 4, option D, cranial nerve 5, 6 and 7. Correct answer is option A, cranial nerve 9, 10, 11 and 12. Question number 113. Which of the following cranial nerves is purely sensory in function? Option A, oculomotor, option B, trigeminal, option C, optic nerve, option D, hypoglossal nerve. Correct answer is option C, optic nerve. Question number 114. The oculomotor nerve is classified as which type of the cranial nerve? Option A, sensory, option B, motor, option C, mixed, option D, autonomic only. Correct answer is option B, motor. Following question number 115. Which of the following cranial nerves are mixed, both sensory and motor? Option A, facial, glossopharyngeal and vagus, option B, trochlear, abducens and accessory, option C, olfactory, optic and vestibulocochlear, option D, trigeminal, hypoglossal and oculomotor. Correct answer is option A, facial, glossopharyngeal and vagus. Question number 116. The trigeminal nerve is responsible for both facial sensation and mastication. It is therefore classified as option A, sensory, option B, motor, option C, mixed, option D, autonomic. Correct answer is option C, mixed. Question number 117. Which cranial nerves are purely motor in function? Option A, cranial nerve 1, 2 and 8, Option B, cranial 3, 4, 6, 11 and 12. Option C, cranial 5, 7, 9. Option D, cranial 2, 5 and 8. Correct answer is option B, cranial 3, 4, 6, 11 and 12. Question number 118. The vestibulocochlear nerve cranial 8 is categorized as option A, motor, option B, sensory, option C, mixed, option D, reflex. Correct answer is option B, sensory. Question number 119. The facial nerve cranial 7 supplies muscle of facial expression and also carries taste sensation. It is a option A, sensory nerve, option B, motor nerve, option C, mixed nerve, option D, autonomic nerve. Correct answer is option C, mixed nerve. Question number 120. Which of the following pairs are correctly matched according to nerve type? Option A, olfactory mixed, option B, glossopharyngeal sensory, option C, abducens motor, option D, trigeminal sensory only. Correct answer is option C, abducens motor.